takes us back a little bit to that too, because we have some of our patients that might be asking that, and I think this article addresses it nicely. So the question might be, what if someone wants to take a single antioxidant, one micronutrient in mega doses? Is that the same thing or has the same impact on the immune system versus, a combination of multiple antioxidants?
I think I tell you what, it is not a good idea, because suppose if you give a vitamin C high dose or any one agent, I give you vitamin C or vitamin E, which has been a lot of study, as you know, clinical study has been done in Alzheimer's disease, heart disease, and so on, and with vitamin C and vitamin E. First, you have to know that these people have very high level of oxidative stress and inflammation already. Now, if you give what happened? Sorry, something I hit it here. So they have already high oxidative stress in their body and high inflammation. Now, if you give a single antioxidant, vitamin E, C, or any other one, they will get oxidized in that high environment. And once they get oxidized, it will act as a pro-oxidant rather than as an antioxidant. That's one major problem. Second problem is, suppose if you give a vitamin C alone. Well, it is a water-soluble vitamin. It can protect only water-soluble molecule in your cell. But what happened? Fats, lipid-soluble. Vitamin E is very important. Then you can say, well, how about glutathione? For example, in COVID-19, vitamin E and C does not bind with the spike protein, but glutathione elevating agent like N-acetylcysteine will do that. So you can see that a single antioxidant cannot work. Also that, many times in a cell have a different, what you call pressure. Oxygen pressure is differ from one compartment to another. And they accumulate the antioxidant at different rate. So if you just give one antioxidant, may not be go in sufficient amount to all the compartment, mitochondria, Golgi apparatus, lipid, all molecules are there, cannot do it. So it is that's why when I look backward, big prestigious Harvard and other institute, they use single antioxidant, knowing fully well. Right. You see, not my discovery, that in a high oxidative environment, one antioxidant, if you give them, they will get oxidized. And oxidized will then act as a pro-oxidant. So either it will have no effect or might increase the risk of the disease. So you don't want to do that. So that's why we develop a micronutrient formulation. Then somebody can say, well, you have antioxidant only. But again, but we also give some B vitamins. We gave some because this is very important for your brain function, for overall health. And so I think, this is important. We gave selenium. Selenium is cofactor for many enzymes, including glutathione peroxidase. Zinc is very important for immune function. But too much zinc, if you give them, it will block the absorption of selenium. Mm-hmm. So one has to be careful in terms of a dose also. That sometimes you say, one of the customer called me, well, selenium, I read some places very good. Can I take a 400 microgram of selenium? I said, no, you will have a cataract. It has been shown that the safety window for selenium is extremely narrow. Mm-hmm. 100 microgram we take from the regular diet, American diet, 100 microgram we have in our supplement. And so, but you just double the dose, you can have a terrible effect, side effects. So these kind of many people don't understand. So for that reason, really, we don't recommend single antioxidant. Even a person who, if you are even older person who have a lower level of oxidative stress and inflammation, why to take a chance?
Yeah, that's a very important point. Yes. So, Dr. Prasad, we have a couple of more questions. I'm going to ask one more question, then my brother. At the beginning, you gave a good overview of how the micronutrients can help. And so what I'm going to do now, Dr. Prasad, is go over different type of symptoms and ask you what type of micronutrients could work for those. So I mentioned our first patient with long COVID had a lot of brain, neurologic, neuropsychiatric symptoms. So if someone has long COVID and has problems with memory, focus, depression, anxiety, what type of micronutrients and supplementation could be useful for that?
Because all those people have the same issue, intestinal dysbiosis, for example, and the brain. As you know, the COVID, the omega-3 fatty acid is extremely important for your brain function. As a matter of fact, 40% of fatty acids in the brain is DHA, which is a component of the omega-3 fatty acid. 40%, because it requires for membranous structure. And brain has the highest level of membranous structure for communication between brain and so on. And so you need, and COVID, our body don't make COVID. I mean, omega-3 fatty acid, our body don't make it. And so we have to take a supplement. Otherwise, you take for example, somebody has vegetarian, meat does not have a COVID-19, fish have certain kind of more than the other.
Omega.
But you can't take everyday fish diet, Fish, I eat mostly fish, I would say 90%, but not every day. But so, and if you take a vegetarian diet, then these alpha ALA, they get converted to EPA, and it's very, very slowly. So the easiest way to get the omega-3 fatty acid, and this is good for you. So what I recommended for those symptoms, a combination. Our philosophy has been that if you are trying to address any particular symptom or disease, you can most commonly practice it among physician world or your world is that you treat symptom one at a time. And but our approach has been that trying to propose this idea that if you have a disease where there is a multifactorial cellular defect, you have to correct them all at the same time. Otherwise, if you do intestinal dysbiosis first and micronutrient second or first, then you will have some effect, no question about it, but not the optimal effect.
Right.
And because the existence of this, say in this case, existence of a neurological issue which can be resolved by not only micronutrient, but omega-3 fatty acid and CBD. And intestinal dysbiosis, which is unique, they have to be corrected. They can be corrected by the supplement that we have, probiotics with probiotics. And so those four combinations and digestive enzyme. So you are treating all the symptoms that you observe at the same time. But if you give just medication, say antidepressant, that's most commonly used in the treatment of COVID all. Sure enough, it will improve some symptoms of depression, but it would not. The disease will continue to progress.
Yes. And you've actually answered my next question, because gut issues play a prominent role. In fact, in long COVID clinics,
yes,
pediatrics often they present one of their first symptoms or major symptom is abdominal pain. And so we know that the gut's important. And so you've mentioned this already, but you want to reiterate some of the gut supplements and how they work.
Yes. And digestive enzyme, because both is very almost complement each other. Because COVID maintains the good health in terms of producing a beneficial short-chain fatty acid like butyric acid and so on. But if you have a digesting problem, it is not going to help digestion, because it depends upon the availability of the enzymes, digestive enzymes. And if pancreas and other things are also damaged and not producing enough, then you need a digestive enzyme.
That's right.
So the probiotic and the digestive enzyme
together. Yes. And again, if somebody wants to suppose under treatment, it would not interact with anything that you are taking recommended by your doctor, anybody, by you or any other doctor. You see what I mean? You understand, but not many physicians understand this.
Yes.
I'm afraid to say that.
So using a combined synergistic approach is very good.
Yeah, because they are not interested. They're so busy. They don't know. They didn't have a training, and they don't have a time to learn more. And so I mean, I published at least 2 papers I published but I have important, core 4 was the Alzheimer and the diabetes. And another one that I just going to appear is you may have heard about flash radiation therapy. That's a new technology, but you deliver the dose rate in a like a nanosecond. Then conventional radiation therapy will take few minutes. So, but that technology again has a lot of limitation, but that is not of your interest right now. But there also I've emphasized EMF radiation. The EMF radiation is also a paper just came out. Did I send you that paper?
I have.
Radiation?
You have that one? Yes.
I have it, Doctor.
Okay.
I would like to see if you could send it to us too.
Because that's another very important thing to protect ourselves, because you are not going to change the kids' habit. You are not going to change anybody's habit. I mean, I reduce it. That's why it is Alara as much as possible for me, because I know about it. But if I tell my granddaughter, now she keeps her cell phone a little away from her when she's not working. Otherwise, she used to keep it in her lap and everything, So, but not many people are aware of this danger. They are still debating whether it causes any damage.
That's right. And I think Dr. Court was going to say something.
Yeah, I actually had a question for Dr. Prasad, and then since he just brought up Alara and Pomara, I thought I'd add something there real quickly. But my first question is, when somebody's on antibiotics, does the probiotic and the digestive enzyme have any effect on the antibiotics function?
No, I mean, if you give antibiotics, for example, people have infection. Sometimes if it is acute infection, I think, and you have to take antibiotics to control it. If you but probiotics there, that symptom will sometimes antibiotics cause diarrhea and some side effect. It might not cause that side effect. And then, of course, as soon as your infection is taken care, intestinal dysbiosis will reverse, because you are taking daily. Yeah, you should take at the time that you are taking an antibiotic, because the antibiotic will kill also bacteria, which you are doing, most of them. But at least they give you a target for that. The more if there are more, then some will survive, And so at least the infective agent will be dead, that is causing problem, and all this, they will survive. So I think at the time, I would say I would take, I don't know, what is your opinion, doctor, that if you are taking antibiotics, should you take?
Would you protect the gut with the probiotic? Yeah, we tend to do that.
Yeah, I think that makes sense, because it would not interfere with the effectiveness of your probiotics, because probiotics is going to kill only the toxic bacteria.
Thank you. And then the second question, it's more of a statement. When I was treating during COVID, we didn't have all these products. And so we did higher dose micronutrients, the higher dose hydro and EMF capsules. And then we were actually using an omega-3 oil, and we were doing higher dose DHA over EPA, as well as what was the other thing that we were using? We had a couple of other things that we're using, but I think the biggest effect, and I was hearing this when we were talking about dysbiose in the gut and so forth, I had all of my patients shut their router off and eliminate all electronic usage during the time that they were fighting COVID. Mm-hmm. And it's very difficult with Pomara. And it was challenging with the patients. The patients that listened to what I had to say and shut all the electronics off the router. Just think about it. We hold our cell phone at our small intestines. We hold our cell phone in our brain. We sit with our laptop on our heart and our chest. These are all symptoms that we talked about in the beginning of this conversation. Those who listened and did that recovered incredibly quickly without any kind of a long haul.
Yeah, I mean, it is, but see, the problem is that this kind of implementation, it is not possible for everybody to do it. They don't because they were work-related, because their habit is there. It is just like almost analogous to, we have been talking about the diet, that you modify your diet for cancer prevention, for Alzheimer prevention, and a very good idea, but nobody follows it. We are talking about the smoking. Nobody does it. A few people do it, and people like me follow it as much as possible, but you can't eliminate it. And therefore, the second best thing that you are doing, Dr. Cord, is have this kind of micronutrient to reduce the potential damage.
Well, and the nice thing about COVID is that people felt so terrible and they were in bed, complete bed rest, that my patients were actually very good at following the protocols.
Yeah, I mean, again, some people who follow diet and everything, they seldom, like for example, in a Mediterranean, some group of people follow diet very strictly. They eat fish and just vegetable, and they live longer without significant disease. But it is only few people in the United States or in the world, including India.
But Dr. Prasad, the people that are on this call that are going to the brain restoration clinic, they are those people.
Yeah.
Tonight,
so I think,
right,
I think we have to continue to propagate this idea that reduce as much as possible because this is not good for you. And then the second alternative is not alternative, but we also try to reduce it and also try to take the micronutrient.
So, Dr. Prasad, one more thing on my end, then I'll turn it over to my brother for the last question. So we know that taking these in combination, the supplements help. And what about the aspect of pain? Because a lot of long COVID patients have pain, whether it's in the head, headache, or joint pain, or muscle pain. Of the supplements, which ones or one has to?
I think the pain component, I think it has been shown that CBD plays very, very important role in reducing pain. And also that, again, pain in part, pain could be related to inflammation as well. So if you are taking in combination with micronutrient and CBD, I think pain should be elevated. Again, nobody has done a clinical trial, but it is all individual trial. Yeah. And because somebody had just the pain and the effect of CBD alone was sufficient to reduce it.
Yeah. And I would think the curcumin too in the...
Yeah. And so I think that's why my approach to combination of at the same time should be eventually people will think that this may have rationale.
And
here is my philosophy that I have in my quotes, that any idea which does not meet any resistance is not a good idea.
Yeah, that's true. That's a good thing. So for that, Dr. Prasad, the last question is going to be a very hard, tough question. Are you ready?
Sure.
Well, it's really on sleep and in fact on melatonin. That's another thing that we've heard a little bit about in the setting of long COVID, its role. So in a more specific way, what is melatonin? But in a broader way, do we have melatonin as part of our products, and how can we enhance sleep? Because that must be important in this equation.
Yeah, I think that's a very good question. Melatonin is very important. As you know, first we thought that it is produced by hypothalamus, only by the brain. But now many other organs produce melatonin. And production of melatonin every day is 100 micrograms. And a standard dose that people take for sleeping, for example, is 3 milligrams. So since it is and many experiments have been done with a single antioxidant. And when you do single antioxidant, you have to do 20, 50 times more to see any effect. And that dose for a longer time is toxic. So I think this is melatonin looks like a natural substance, but if you give a very high dose, it has many side effects. And so the only place we have a melatonin, and melatonin is very important to sleep, and this calm you down because this also increases a serotonin level, and for example, But in sleep, only place that we have melatonin is in the sleeping pill that we developed recently, sleeping boost, we call it sleeping boost, where we have a 3 milligram of melatonin and also some L-tryptophan, because they are precursor of a serotonin. So we said, well, serotonin can increase at the same time that melatonin is doing his work. And an interesting thing about melatonin is that its production is regulated by light. If you have a sharp light, it will turn off production by all organs. That's why in the night, they produce it. And when you wake up, then they get turned off. So this is important thing to remember. But probably you know all these things. But the problem is that only product that we have melatonin is the sleeping pill. And sleeping disturbance is very important. But suppose, in COVID, even COVID hall, many people have sleeping disturbances and other symptoms of COVID, long haul COVID. And again, there we have only melatonin, L-tryptophan, and we have a tulsi or holy basil. In Ayurvedic medicine, has been used for 1,000 years, and in India for many purposes, including sleeping. And another herb is ashwagandha. This has been also used in Ayurvedic medicine in India for 1,000 years, very good for sleeping. But I have not given it a high dose. That's, because even herbs, if we give high dose, that's not good for long-term consumption. And so and people who are taking the sleeping pill, including me, I used to take before that, a 50 milligram or 2 capsule of CBD and 3 milligram of melatonin. That was my sleeping pill. So when sleeping became available to me, then I replace. I take this CBD, but I replace only one. I take a sleeping pill. And tell you, the soundness of sleep, deep sleep, have increased. I used to sleep reasonably well, but not the deep sleeps. Even if I get up, in the nighttime, but it is a deep sleep after. And sometimes I never used to remember any dreams. Yes. But even in deep sleep, then was not every day, but some days I remember very vividly some dreams. That's a new phenomena. But anyway, so that's to answer your question, that is the only product has is melatonin. Rest of the product there was no need for, because you don't want people walking in a daytime, might have some sleeping effect if you give too much. But so we don't have in other product, but we have in a sleeping pill.
That's great.
So you can even in a COVID-19 long hauler, I think you can use, because there is nothing toxicity.
That's good to know.
That's important.
Thank you. Thanks for answering our
Is
question.
the new sleep boost safe for children that have trouble sleeping?
Yeah. If they're having problem with sleep, there is nothing there that can be hurt.
Very good.
No, that's a lot of our patients. So.
Yes, the only thing I might caution is if someone's on a serotonergic drug, to be cautious because of so-called serotonin syndrome. So the 5-HTP that can convert if someone's on a sufficient dose of serotonin, there could be a little interaction that way. So one would just be cautious, and so it's important to discuss with the provider. So
yeah. But in general, for children, the dosages are small enough that for sleeping purpose, until you have specific needs. Again, you guys have to decide, but I feel that it is safe for the children. That's one product I will say. Gummy is safe for the children in case of micronutrient.
Yeah. And frankly, we would hope that we wouldn't have to compete with too many medications on board anyway. So that's why we're discussing.
Another thing I always say that, for anybody, that it is a good idea to have some meditation.
Yes.
Calm you down, I mean, it is a good, healthy practice. 15 minutes. You don't have to do, an hour, go in the forest and do meditation there. But it is, I do it every morning for 15 minutes.
That's great. Thank you for answering our
Yeah.
questions. That was great.
Yes, thank you
Excellent.
for covering that. We certainly believe in micronutrients, and we think that in the
Yeah,
right
I mean, I'm
combination.
glad that you two are very interested in this business, because not many people, in your discipline, physician, I would say. But anyway, anytime, for example, last week, one oncologist called me, and I gave some data about the cancer therapeutic dose versus. She was concerned. She was a radiation oncologist. So I told her that, I'm a radiation biologist, and here is the current thinking. And patient, it would not hurt anything. But she would not buy it. He said, well, I think it will interfere with my... I said, yeah, it will interfere if you give a preventive dose. But we are talking a therapeutic dose work by different mechanism. It has nothing to do with scavenging free radicals. But I could not convince him. So then I said to patient that you follow Dr. Rice. I mean, I can't say, no, you can't do that.
Yes. Yes, providers.
So it's difficult because their set of mind is antioxidant has been known to interfere with the treatment of radiation.
Yeah, we've heard.
Don't distinguish between a low dose and high dose.
High dose, That's right.
That's not.
So I have written a paper. I'm going to, when I come back from my vacation, it is only for 5 days. Then I will send for publication that paper.
Yes, we'd love to see that. Yeah.
On which one? On
The high dose antioxidant.
That'd be good to see.
Provide all the data and everything, from my lab and other people, and so. And another one is, which is very interesting, that I was not aware of, that when we talk about intestinal dysbiosis, even in a cancer, intestinal dysbiosis play important role about the effectiveness of chemotherapy and radiation. And chemotherapy and radiation already existing gets aggravated. So then treatment become resistance. Tumor become resistant to this kind of treatment. Then what you do? And so we are trying to say that, we do treatment, whatever you do are doing it, but at least correct the dysbiosis so that your effectiveness will increase.
Yeah,
so that paper is also ready to go, but I don't.
We'd love to see that, and we certainly see an emergence of
the
microbiome.
That's very important, to see. I never thought that in a cancer it will happen. When I was looking at the literature, it is loaded with data.
Yeah, please share that with us too. That'd be important.
So those two papers are ready to be gone, but I'm taking it so that in a plane I get bored, so I can make sure I correct it.
89 years young, and he's got
89 plus.
89 plus. We got that. So Dr. Prasad, it's 10 till, and I want to thank you, everybody on here tonight. Thanks you so much. But we're going to go ahead and release you, and we'll see you next Tuesday for the Optimal Longevity Series.
Next Tuesday, okay. Next Tuesday, next Tuesday I will be here. No, next Tuesday I won't be here because I'm leaving on Sunday, coming back on Friday.
Well, then the following Tuesday, after vacation,
So I will miss the whole week.
Unless, of course, you want to join us with your flower shirt and do it, we'd be honored. But it's up to you, sir.
Thank you, Dr. Prasad.
Thank you, Janet.
Thank you, Don.
Thank you, Dr. Prasad.
Thank you for answering our questions.
Bye-bye.
Good night.
So Dr. Corbier's, what an amazing, so I'm sitting back there. I want to summarize. We've got about 8 or 9 minutes, but I wanted to review some of the symptoms, because what we saw at the beginning, right at 2020, we saw a lot of taste and smell, those cranial nerves. We saw chronic fatigue and insomnia, lots of pain. Some of the newer ways that they're presenting are POTS. And so we're seeing a lot of dizziness, and we're also seeing, of course, insomnia, but swallowing issues. So swallowing. And we actually saw this the last few months traveling. It was a clear pattern to us that we were seeing a lot of women above the age of 40 that were saying they were having problems swallowing. And so those cranial nerves, we have the glossopharyngeal, the vagus nerve, the hypoglossal are being affected. And so I want to know that seems to be linked to this as well. Okay.
Yes.
And I thought that was, they may seem not connected, but they are. So these symptoms could get to the root, right?
Yeah.
So I thought that was fascinating. But when you looked at Dr. Prasad's work that he produced at the beginning of COVID regarding the mechanisms of action, it's a great paper. So for those of you that don't have it, we put it up there and you can go get that paper yourself, and you can walk through the mechanisms of action. But I think really the core four, the multi-micronutrient that had 24 million in research that reduces oxidative stress and inflammation. Then we have the dysbiose of the probiotic. And then we have the omega-3, which he kind of skipped over. But when you have the appropriate omega-3 balance in our patent pending omega-3, it will help with the lipid raft and the ACE2 receptor when you have those omega-3s. And then lastly, he didn't mention the collagen, but the collagen can help with those building blocks of sleep. It's almost a complete protein except for tryptophan. And so I think that those four.
Where's the tryptophan?
It should be found in the gut. It should be made in the gut microbiome, which is in our probiotic, which is wonderful. And so I also thought that he did a good job with the endocannabinoid system about both the omega-3 and the CBD. That's not working very well. So when we get those building blocks in there, we can help, with that. I think that his perspectives on the root causes and then the multi-micronutrient approach, which is really his novel approach to the root, no matter what symptoms are presenting. And they're kind of new variations now. We're also seeing intermittent peripheral pain. And it's intermittent, but it's debilitating. So if you have any of these, we can get to the root of that with the core four. And if you have pain, you can use the CBD to be able to help. One of the things also I want to talk about sleep, because we're certified in sleep medicine and we've tried lots of different sleep products, structurally nasal. We've tried products. We've never recommended an oral sleep product because we never have felt that it was delivering the measurable outcomes, and people felt groggy. And so that was always the feedback. So we're seeing really good feedback when we beta tested it. But most importantly, what he didn't talk about is like the melatonin is the sleep pressure to help you to get to sleep. But it really is the Tulsi and the ashwagandha actually both help modulate the GABA. So not just Ayurvedically, they're helpful with that. So we feel very promising results for people with sleep that are insomnia based, that they don't have the building blocks, and to be able to get to restorative sleep, which is the key to healing. That's when we heal. And so we're super excited about that. But with the micro daily EMF core product is where the B6 is. And we need to make sure we take the foundational micronutrient products so that we have that rate limiting B6. We have that in our diet twice a day when we take the sleep product. Because standalone, I think it's great, but I think it's going to work optimally with that. So people that are having those sleep issues, I believe it's going to be safe, and we see those measurable outcomes.
Well, and I think it's really important too, Jonah, that when he mentioned melatonin in the brain, and then he said, it's inhibited by light. But we can take that just a step further and say, if we're looking at our electronics last thing at night, we actually inhibit the release of that melatonin. And now we've changed the sleep cycle. And this is why, our digital hygiene is so important. Yeah. And it's important bringing that back to the beginning when you were talking about the symptoms that we're seeing in COVID, long haulers, long COVID, these symptoms are all directly correlated, I believe, to areas of complaint. We look at our head, we look at our eyes and our eye fatigue. We look at swallowing issues when we're talking on speakerphone, pointing at our throat. We're looking at cardiac issues when we talk on speakerphone. And then we're looking at dysbiose in the gut. There's a lot of literature out there about radio frequencies affecting dysbiose.
Well, I wouldn't say direct, but
okay, then say what you would. Correct me so I'm right.
I wouldn't say direct, but I would say that reducing exposure is very much important. And I think that the research is getting much stronger. And Dr. Prasad's latest paper, so he dropped some nuggets. I wanted to say that on the way out. We do have a brand new paper that he has submitted. It's a gallery proof, which means it's been accepted, but it's not available for everybody on EMF radiation. And it has 89 citations on why we need to reduce exposure and a biological approach. Number one, we just heard that he's submitting a high dose radiation paper for the treatment of cancer. So he just told us that nugget too. It is, all of his free time at 89 years young, which I think is fascinating. For you two in the clinic, as we wrap up, what do you think the most important nuggets of Dr. Prasad's body of work for the patients coming in and they have different presenting symptoms, for them to understand that his approach can help them? Like, what do you think is the most important thing that Dr. Prasad brings to the table?
Yes. So I think one of the most important things pertains to the role of micronutrients and the synergy that these micronutrients bring together. Because if you look at a condition like long COVID, there are various things going on at the level of the vascular system, cytokines, chemokines, even the brain symptoms. We know that the glial cells, the scaffolding of the brain, that's where some signals are affected, and you can get all of the brain fog and things like this. So knowing that there are micronutrients that, if taken together safely with the right ratio, can then affect multiple mechanisms of action that can help. So that's the key factor, not a single high dose of an antioxidant, which can become pro-oxidant, he says, but the combination with multiple actions to help. So I think that that's really, let me also add, Jet, that a brain boost, I think, could be very useful, because a lot of people have brain fog, a lot of symptoms that, if that's added on, can do very well.
Well, and with that, real quick, with the NAD, we're going to go over just a minute, because I want to ask Dr. Paul this when we wrap up. With the NAD, I know a lot of people take fairly high doses of that, and that is just really, when I asked Dr. Prasad about the delivery systems of like NAD, IV, he just really felt that those weren't good delivery systems, and that by taking the brain boost, 2 times a day, that you would be getting a better delivery. It's easier on the patient, and more is not better, right? It's getting that. What are your thoughts on that, Dr. Paul?
No, we haven't used NAD much. We might have referred a patient or two in the past, but the more we look at the way these particular micronutrients have been formulated, we feel that it covers a lot of grounds, again, because of the way they're put together. So I think it's been well thought out. And so, yes, I would agree that there's really not a big need for that with these newer tools and combinations.
Yeah, let me just say that biochemically, and I know you're a biochemist, is that you could blast the system with a big dose of something to drive a response, or you can do it more organically, looking at cofactors and things working together. And I think the body prefers the latter, safer, less side effects.
And a take-home message, I think, on the long COVID part of this is just for our listeners, just to know that there are many presentations of long COVID. So if someone was exposed, had the illness, however mild it might have been, and they're not the same since then, they really need to start thinking about COVID. As we were all talking, it just dawned on me that there's really an assault on the cranial nerves too. So whether it's the taste, that's the cranial nerve, the olfactory nerve, taste, smell, but the 10th cranial nerve, the vagus nerve, as we're talking about, with POTS and postural, tachycardia, heart issues, dizziness that we're talking about, fainting spells, all that. That's an assault on the vagus nerve, inflammation, and so forth. So we find that as we ponder these micronutrients and what they're doing together, it really can help protect our cranial nerves and our entire system. So
I think that is such an important point.
I think we should talk for another hour.
I know. No, that's we're going to segue into that. That's at another call. But I also want to say the mega dosing, like when we to bring that back up, when you mega dose on zinc, it really throws a lot of things out of balance. And so people are saying you need to take mega C or mega zinc, and then all of a sudden we have pro-oxidants, which means it creates more, what fancy word for saying it creates more free radicals and damage. And then you have the imbalance and people saying more is better with the zinc, which can also throw out the copper and selenium that have other important jobs. And so Dr. Prasad is the expert of the formulations, that they're safe for everybody. And I think that that's really important, that megadosing, there are a lot of different hypotheses and theories out there. And that I think you really hit that home tonight, that's one of the reasons why, with the synergy of the products in his body of work, that I think is going to be really helpful for people on here. More is not better, especially taking that handful of zinc could cause other issues.
Yes, that's right. Totally agree. And a lot of this is in the article too, so it's worth reading. I think it's well delineated. Yeah.
I have one last thing that I want to just put a bow on this, and then we can let everybody go. But doctors, you see some of the most fragile patients. You are really an epitome of a team of people who treat the most fragile. Have you ever seen a group of products that work so well together that don't have contraindications for your patients? Have you ever seen anything that works the way that these micronutrients work in your professional opinion?
We haven't, and I think what we like is the dosing aspect, combining smart combination of the supplements. For example, there are other supplements out there where the formulator may put a bunch of nutrients in there, just to attract individuals. There's this and that, things that may actually be counterproductive. So I think with Dr. Prasad, there's been a lot of thought of which nutrients, ingredients, dosing, which goes together, which should be left out. And I think he does a fantastic job, not to mention all of the research behind it. So we're very comfortable with that.
And the niche, I think it addresses a lot of the issues that we see in our practice, whether it's sleep, whether it's the anxiety, whether it's gut health, and right down to the strain in the probiotics, prebiotics, the type of prebiotic fiber chosen. So we think that we appreciate the thought process that went behind each ingredient in each product. So we really feel comfortable with that.
And in terms of mechanism of action, inflammation, oxidative stress, that's the basis of a lot of chronic ailments. And so tackling both of these simultaneously, there's no better.
Wow.
Perfect answer.
Wow.
Thank you.
So exciting. So Dr. John Rennell and Dr. Paul, we're going to have you on about a month from now, and we're going to do a deep dive in the gut, right? Gut dysbiose, and how important, because that's where a lot of our building blocks are made, or not.
No,
right?
Absolutely right. Absolutely.
And so we're going to do a deep dive on that in a month. And I'm excited about that. And then get back to the person that invited you to get on this call and get ready to get started. And if you have some of these symptoms I just think that this is a call, really a great hope that you're not alone and that there are strategies to help. So get back to the person to get started. And if you want to watch this video or any of our other videos, you can go to Team Serve on YouTube and watch them there. But I want to thank you again, Dr. Corbier. You both are awesome. And also your team. You have an amazing team that help you serve as well.
Phenomenal team. And I wanted to just, put this to bed and talk about the last thing on the sleep product. One of the things when we were doing the beta testing that just blew me away was the fact that you take the sleep product, and within about a half an hour, a very calm came over me, where it's just like, I think I'm going to go to bed. And then And the wake up was the most amazing, besides having just a tremendous sleep and like Dr. Prasad said, actually vivid dreaming and remembering the dreaming. But the wake up period was incredible because you just wake up and instead of kind of dragging yourself out of bed, I woke up clear.
That's amazing.
And just like, okay, I'm awake. What am I going to do now? What's my day look like? I mean, it was just wide awake. I've never, ever used a product like that. So,
and we measure.
And we
So
measure
we
that, and
know.
we're going to start doing some
Yes.
little sleep trials on that.
That's a good addition.
Yes, that is amazing. That is
because you need sleep for brain healing and things like that. So sleep is important.
Well, and we need to talk about that. We'll talk more. I want to talk more about cranial nerves. Love that aspect. So vitally important. So I guess with that, we should put this to bed, right?
Yep. Thank you guys so much.
Well,
And
thank you. Thank you.
Yeah,
This was great.
Thank you.
Have a great day.
Take care.
Be well. See you next week.
Bye-bye.
Bye-bye.